As a new patient, I would like to talk to you about medication options to help you transition, including medication choices, physical changes and expectations from hormone therapy, the possible side effects, as well as cost information. Many patients are very eager to see rapid changes. However, it is important to remember there are many individual factors that affect how quickly you will see changes, as well as how significant those changes are. Some of these factors include your genetics, the age at which you start hormone therapy, as well as your overall health. It is important to think about this process as a second puberty, and puberty takes several years for full effects to be seen. There are 3 different types of medications that can be used for feminization. These include estrogen, androgen antagonists, also called testosterone blockers, and progesterones. Estrogen is the main hormone responsible for most female characteristics. It is available as a tablet, patch, or injection. The 2 most common testosterone blockers used are spironolactone and finasteride, and both of these come as tablets. Progesterone medications are reserved as second-line options in patients who do not respond to estrogen plus a testosterone blocker, as they are not as effective as estrogen and have some negative side effects. The form of estrogen we use is plain estradiol, which is different from the type of estrogen in birth control pills. Plain estradiol has the lowest risk of blood clot formation. The most common form of estrogen we use is a patch, as it is safer compared to the tablet and injection, and it provides the most consistent estrogen level. The patch is well tolerated and rarely causes skin irritation. There are 2 types of patches. One is applied once weekly, and the other is applied twice weekly. The one we use most commonly is the twice weekly patch, as it seems to stick on the skin better. The patch is generally applied right below where your pants sit on your waist, either slightly in from your hip bone, on the side of your hip, or right above your buttocks. You should rotate the application site to avoid irritation. The patch should also be applied to a clean, dry, hairless area. The tablets are a convenient dosage form, however, they are not recommended in patients who smoke or those over the age of 35 due to an increased risk of blood clot formation. The tablets also undergo what is called first-pass metabolism, which means your liver will break it down before it becomes active in your body, and this can result in less consistent estrogen levels. Some people will take the tablets under their tongue and let them dissolve to try to avoid the liver effects. Lastly, the estrogen injection is the least common form our patients use. It results in the most variable estrogen levels, which can result in mood swings and sometimes hot flashes, as well as worsened migraines. The testosterone blockers either block the effects of testosterone or prevent the production of testosterone. A testosterone blocker is always used with estrogen to increase the safety of hormone therapy. This is because with low levels of testosterone, we can use lower doses of estrogen to achieve the same feminizing effect. Some patients who want a small amount of feminization only may choose to use a testosterone blocker on its own. It is important for us to discuss the irreversible changes of hormone therapy. Breast development is one of the irreversible effects of hormone therapy. Breast buds may begin to develop below your nipples within a few weeks after starting hormone therapy, and this can often result in tenderness and pain in the area. The pain will improve with time and eventually go away within several months. It is important to understand breast development varies from person to person. Most transgender women, even after many years of hormone therapy, are only able to achieve an A cup or a small B cup breast size. The size and shape of breasts are also dependent on genetics. Another potentially irreversible effect is the ability to parent a child from your own sperm. Within a few months after starting hormone therapy, the production of sperm stops and may never return. Some people may continue to produce a small amount of sperm or may have a return of sperm production if they stop hormone therapy. However, it is important to understand this may not be the case for you. It is also important not to depend on your hormone therapy as a form of pregnancy prevention, given a small amount of sperm may continue to be produced. If there is any chance you will want to parent a child from your own sperm, you will want to consider banking sperm prior to starting hormone therapy. The doctor can give you more information on this. After 1 to 2 years on hormone therapy, your testicles will shrink to less than half of their original size, but the scrotal skin available for possible future genital surgery should not change. Next, I would like to discuss additional effects of hormone therapy which are reversible. Some of the first changes you will likely experience involve the skin. Your skin will become thinner and drier, and your pores will become smaller and produce less oil. You will likely notice you sweat less, and the odor of your sweat and urine will also likely change. With thinner skin, your sensation of touch may change, and you may also notice you bruise a little easier. A change in sex drive and erections also occurs soon after starting hormone therapy. For most people, spontaneous erections go away completely. You will likely still be able to achieve an erection with arousal, although the erection may not be as firm or last as long. Some are not able to achieve an erection with arousal at all. If this happens to you and is bothersome, there are medications we can prescribe, so make sure to let your doctor know. Your body will begin to redistribute your weight after 3 to 6 months on hormone therapy. Fat will collect more in your hips and thighs, but hormones will not significantly affect fat in your stomach area. Your face will take on a more feminine appearance as the fat content under the skin increases. It can take 2 or more years to see the full effect of changes in fat distribution. Therefore, we usually recommend waiting to undergo any facial feminization until you have been on hormone therapy for at least 2 years. The muscles in your arms and legs will become less defined and smoother, and your overall muscle mass and strength will decrease. After a few months on hormone therapy, you can feel confident lifting weights without gaining bulky, masculine muscle, as your testosterone level will be low. Lastly, let's discuss one of the more frustrating aspects of feminizing hormone therapy, which is the effect on the hair. The hair on your body and face will decrease in thickness and grow at a slower rate. Unfortunately, the hair will rarely be eliminated, and many patients choose to undergo electrolysis or laser hair removal. On a more positive note, estrogen does protect scalp hair. Scalp hair loss will stop for those that have already experienced it, and the hair will be protected throughout life for those who may have balding in their genetics. Blood clots are a rare side effect of estrogen therapy, but it is important you are familiar with the signs and symptoms to look out for. Some risk factors for blood clots include being over the age of 40, smoking, being significantly overweight, or having a genetic trait that increases your risk. A blood clot generally forms first in the leg. This is called a deep vein thrombosis, or DVT. Symptoms of DVT include swelling in one leg, especially the calf, redness, warmth, and possibly pain. Not all patients have clear signs of a clot in their leg. If a small part of that clot breaks off, it can go to the lung, which is called a pulmonary embolism, or PE. A clot in the lung is more concerning and can be life-threatening. Symptoms include severe shortness of breath or chest or back pain. With any of these symptoms, we would want you to go to the emergency room right away. As discussed earlier, the estrogen patch has the lowest risk of blood clot formation. Patients often wonder if estrogen will change their risk of cancer. Estrogen should decrease risk for prostate cancer, but it is still important to have regular prostate cancer screening. Your doctor will tell you when this is recommended. Trans women on estrogen therapy will have an increased risk of breast cancer compared to non-transgender men, but the risk will be lower than the risk for non-transgender women. Your doctor will likely recommend you start breast cancer screening when you are between 40 and 50 and have been on hormone therapy for at least 3 to 5 years. Lastly, estrogen can increase weight a small amount and may increase blood pressure. Both of these can possibly increase risk for heart disease. However, we have little evidence to tell us if hormones affect heart disease risk. The most important thing for your heart is to eat a well-balanced diet and exercise regularly. Now we will discuss side effects of testosterone blockers. Overall, spironolactone is well tolerated but can make you pee more frequently. Some patients experience dizziness or lightheadedness, especially after first starting the medication. It is important to drink plenty of water while taking this medication. The potassium level can also be increased when taking spironolactone. This should not cause you to have symptoms, but it is something we monitor regularly with your labs. If potassium levels are high, it can put patients at risk for heart problems. Finasteride is a very well-tolerated medication and rarely has any side effects. Lastly, I would like to discuss the cost of medications. The good news is almost all insurance will cover hormone therapy. The prices listed here are for people without insurance paying cash for their medication. The tablets are the lowest cost form of estrogen, and the costs of spironolactone and finasteride are similar. Thank you, and please don't hesitate to reach out to the clinic with questions or concerns.